Now, the election may not yet have been called. Not that you would have any idea that that's happened, because the government is in full campaign mode, and Labor's latest bid for votes is an $8.5 billion spend on Medicare to guarantee cheaper GP visits for every Australian.
No asterisk, no fine print, no terms and conditions, just 100% bulk billing covered by Medicare.
The move would mark the biggest single investment in Medicare since it was created and bring the bulk billing rate up to 90% over the next 5 years, up from the current rate of 21%. Now, it's an ambitious plan from a party that failed to deliver on its promise of $275 power bill cuts. Suddenly, it's going to find an extra $8.5 billion in the budget, and Labor hasn't said how it plans to pay for all of this. It's in a surprising move, too, that the coalition decided to blow up any likely ploy by Labor to present another Medicare, and the opposition has vowed to outspend Labor. It's pledged to match the government spend in addition to an already announced extra $500 million on mental health.
The coalition government is committed to $9 billion worth of investment into our general practice network. It will provide support to training, it will provide support to mental health services, and it will provide support to making sure that practices are viable and can provide a mix of services to patients, and it'll help build those bulk billing rates back up to what they were under a coalition government.
Kel, was this a good move by the government and by the opposition today?
When it comes to the opposition, this is nuts. This is crazy, this is insane, and I don't like it. I cannot understand why they've decided to jump on this. Well, maybe I can. Maybe they were worried, because Medicare has worked in the past, and the Labor Party always puts out these totally false, totally fabricated claims that we started Medicare, Libs just want to shut it down, so it's going to cost you a fortune. So perhaps they were trying to head that off, but this is a really bad way to do it. Up until now, this sort of non-election campaign has consisted of Anthony Albanese knocking on your door saying, Caroline, I'm Anthony Albanese, I want to spend more of your money. And he does it again and again and again, so the spend gets huge and massive. Now, for Peter Dutton to jump into that game and say, hey, if he's going to spend your money, I'll spend your money, I'm sorry, it makes no sense. What we want from the Liberals is sensible, responsible economic management. That gives us confidence, not the idea of we'll match them dollar for dollar. I'm sorry, that's nuts. I can sort of understand that they're really frightened of a Medicare campaign and all the lies that Labor tells about Medicare and the Liberal Party. So I understand that, but this is the wrong response. I mean, as far as Albanese is concerned, it doesn't matter what he says, because no one believes him anymore. He's made all these promises, none of them got...
Well, then we don't have to worry about where the money's coming from then. Yeah. Problem solved.
It's the Medicare scare that they're so afraid of.
I think clearly, I mean, obviously you would have seen all the sort of frenzied debate about bulk billing over the past few weeks that led up to this announcement.
Yes.
Zero. None. Nothing.
Did you see? It was
I described it earlier today as sort of an answer to a question nobody asked. But tactically, what they're trying to do is, as Kel said, they want to frame Peter Dutton as the killer of the murderer of Medicare. They've already got the grab that they clipped up from 10 years ago or whatever it was to play over and over again. They just don't have the facts to fit the campaign that they've already set up, and
that's a common theme, isn't it? Not having facts.
Obviously, the plan was, and it would have been really clever if it had worked, but the plan was to say, right, we're going to drop this massive spend, and Dutton, by not doing it, we can then say, see, we've got this plan to save Medicare. Dutton's not doing it, therefore he's basically killing Medicare.
The issues when he said no asterisk, right? He said, oh, there's no conditions. Well, actually, doctors can choose not to bulk bill. This is just an incentive to get them to. So less than 1 in 4 are currently bulk billing. If there's not enough money, they might not do that. And if they're not bulk billing, then you can't guarantee that every single person is going to get it. And the Labor Party's actually removed over $350 million worth of pathology tests that you can't claim on Medicare from the 1st of July for B12 and urine tests, which 80% of women in their 20s and 30s use. So you can't say we're doing this wonderful thing But behind the scenes, we're slashing stuff.
Well, when you look at the detail, it's doctors will get an extra $21.50 and $32.80 per patient they decide to bulk bill. There also is a plan to take a number of doctors, hundreds, out of the state hospital system to move them into these sorts of GP clinics, which then begs the question, what happens to the hospitals, which are already struggling and under a lot of pressure? But Evelyn, look, I think Joe's right. Clearly they were hoping to wedge Dutton on this, and even the Prime Minister said in this announcement today that coalition can't be trusted on health after a decade of cuts. So I guess they would have been caught a little bit off guard by the fact that he's gone, well, we're going to match that, and actually we're going to spend $500 million more than you, but where is the money going to come from?
Oh, from us poor peasants. That's exactly where it's going to come from.
The tax I just paid in my small business.
That's right. I mean, it's very easy when you're spending other people's money. And that's the problem with our politicians, is that it has become so normal for them to spend, because at the end of the day, regardless of the outcome, regardless of the consequences, it doesn't ever fall on them because they're still paid by us.